Reading from the First Aid Merit Badge Series pamphlet for the Boy Scouts of America for the sight impaired Scouts. The requirements are to demonstrate to your counselor that you have current knowledge of all first aid requirements for tenderfoot, second class, and first class ranks. Explain how you would obtain emergency assistance from A, your home, B, a remote location on a wilderness camping trip, C, an activity on open water. Define the term triage. Explain the steps necessary to assess and handle a medical emergency until help arrives. Number 4. Explain the universal precautions as applied to the transmission of infectious diseases. Discuss the ways you should protect yourself and the victim while administering first aid. Number 5. Do the following. A. Prepare a first aid kit for your home. Display and discuss its contents with your counselor. B. With an adult leader, inspect your troop's first aid kit, evaluate it for completeness. Report your findings to your counselor and scout leader. Number 6. Describe the early signs and symptoms of each of the following and explain what actions you should take. A. Shock. B. Heart attack. C. Stroke. Number 7. Do the following. A. Describe the conditions that must exist before performing CPR on a person. Then demonstrate proper CPR technique using a training device approved by your counselor. B. Explain the use of an automated external defibrillator, or an AED. Identify the location of the AED at your school, place of worship, and troop meeting place if one is present. Number 8. Do the following. Show the steps that need to be taken for someone who has a large open wound or cut that is not bleeding severely. B. Show the steps that need to be taken for someone who has a large open wound or cut that is severely bleeding. C. Tell the dangers in the use of a tourniquet and the conditions under which its use is justified. 9. Explain when a bee sting could be life-threatening and what action should be taken for prevention and for first aid. Number 10. Describe the signs and symptoms and demonstrate the proper procedures for handling and immobilizing suspected closed and open fractures or dislocations of the forearm, the wrist, the upper leg or the thigh, lower leg, and ankle. Number 11. Describe the signs and symptoms and possible complications and demonstrate care for someone with a suspected injury to the head, neck, or back. Number 12. Describe the symptoms, proper first aid procedures, and possible prevention measures for the following conditions. A. Anaphylaxis or an allergic reaction, bruises, sprains or strains, hypothermia, frostbite, burns, first, second, and third degree, convulsion or seizures, dehydration, muscle cramps, heat exhaustion, heat stroke, abdominal pain, a broken, chipped, or loosened tooth. Number 13. Describe the conditions under which an injured person should be moved. If a sick or injured person must be moved, tell how you would determine the best method and then demonstrate this method. And C. With helpers under your supervision, improvise a stretcher and move a presumably unconscious person. And number 14, teach another scout a first aid skill selected by your counselor. The introduction. First aid. Caring for injured or ill persons until they can receive professional medical care is an important skill for every scout. With some knowledge of first aid, you can provide immediate care and help someone who is hurt or who becomes ill. First aid can help prevent infection and serious loss of blood. It could even save a limb or a life. The goals of first aid: to protect a person who is injured or ill from further harm, to manage life-threatening medical emergencies, keeping the airway open, maintain breathing and circulation, stop serious bleeding, and treat for shock. Get professional medical care for the person. The first aid requirements for the tenderfoot second class and first class ranks encourage you to practice treating certain injuries and ailments. Earning the first aid merit badge will help you understand that emergency medical treatment is a set of clear action steps. By following the steps, every time you come upon a first aid emergency, you can quickly evaluate the situation, come up with a first aid plan, and then see that plan through. First aid rank requirements: tenderfoot first aid, 4A, B, C, and D. 4A, show first aid for the following: simple cuts and scrapes, blisters on the hand and the foot, minor thermal or heat burns, or scalds, superficial or first degree, bites or stings of insects and ticks. 4B, describe common poisonous or hazardous plants. Identify any that grow in your local area or campsite location. Tell how to treat for exposure to them. 4C, tell what you can do on a campout or other outdoor activity to prevent or reduce the occurrence of the injuries or exposure listed in tenderfoot requirement 4A and 4B. And 4D, assemble a first aid kit to carry with you on future campouts and hikes. Tell how each of them in the kit would be used. Second class requirements gets a little bit more detailed, if you will. Demonstrate the first aid for the following: an object in the eye, the bite of a warm-blooded animal, puncture wounds from a splinter, nail, or fish hook, serious burns, partial thickness or second degree, heat exhaustion, shock, heat stroke, dehydration, hypothermia, and hyperventilation. 6B, show what to do for, quote, hurry cases, unquote, of stop breathing, stroke, severe bleeding, and ingested poisoning. 6C, tell what you can do while on a campout or hike to prevent or reduce the occurrence of the injuries listed in second class requirements 6A and 6B. 6D, explain what to do in case of accidents that require emergency response in the home and backcountry. Explain what constitutes an emergency and what information you will need to provide to a responder. 6E, tell how you should respond if you come upon the scene of a vehicular accident. First class requirements. 7A, demonstrate bandages for a sprained ankle and for injuries on the head, the upper arm, and the collarbone. And 7B, by yourself with a partner, show how to transport a person from a smoke-filled room. Transport for at least 25 yards a person with a sprained ankle. 7C, tell the 5 most common signals of a heart attack. Explain the steps or procedures in cardiopulmonary resuscitation, or CPR, and reducing risk. One way to stay healthy and safe, both at home when you are in the out of doors, is to recognize that there is an element of risk in many activities. By being aware of risk and adjusting your behavior to manage it, you will also be in a stronger position to provide assistance should an emergency arise. Among the ways you can increase your role in risk management during scouting adventures are the following. Stay in good physical condition so that you are ready for the demands of the activities that you enjoy. Know where you are going and what to expect. Adjust clothing layers to match changing conditions. Drink plenty of water. Protect yourself from exposure to the sun, biting insects, and poisonous plants. And above all, take care of your gear. Scout troops and patrols can also manage risk as a group. Review and practice first aid skills and techniques on a regular basis. Take responsibility for having a safe experience. Be sure everyone understands and follows group guidelines established to minimize risk. Ensure everyone has a say in recognizing and dealing with risks that might arise. And there's a little note at the bottom of the page here that says, after you learn first aid skills and techniques required for the First Aid Merit Badge, you can teach another scout what you have learned. Teaching a fellow scout a simple first aid skill is a great way to practice and gain mastery of the skill, and will also allow you to complete requirement number 14. How to handle an emergency. Even the best plans can fall apart. Accidents will happen. People will become sick. You might be the person who is most able to take charge of an emergency scene. And here is how you should proceed. Do your best. Good Samaritan laws legally protect anyone making a good faith effort to help the victim of an injury or illness. Whenever you are confronted with a first aid emergency, use your skills to the best of your ability and training. No one expects you to have the knowledge of a physician. However, scouting's history is filled with stories of scouts who have used their training to help others, sometimes even saving lives. Number 1, check the scene. The site of an accident can be confusing, especially when serious injuries have occurred, or there is more than one person involved. There are a number of things to consider. The hazard that caused the accident may still pose a threat. Seeing blood, broken bones, vomit, or people in pain might disturb bystanders and those trying to provide first aid, i.e. first aiders. Before you take any action, stop for a moment to look over the entire scene and collect your thoughts. Consider the following questions. What caused the accidents? Are there dangers in the area? How many victims are there and how badly are they injured? If there are other people nearby, can they assist with first aid or with getting help? Will bystanders need guidance so that they do not become injured or ill themselves? Number 2, call for help. Mobile phones are unreliable in wilderness areas. If you take a mobile phone on an outing, have a backup plan for summoning emergency assistance. Should you encounter a situation where someone has more than a minor illness or injury, act quickly to get emergency medical help. You can reach emergency services in much of the United States by calling 911. Some communities use other emergency alert systems such as dialing 0 or calling a local sheriff's office or fire department. Instruct a bystander or another first aider to call for help immediately. You call for help right now. Tell them where we are and what has happened, and then report back to me. A wilderness camping trip can take you far from telephones. An injured scout who can walk on his own or with some support may be able to hike a road. A group of scouts may be able to build a stretcher and carry a victim. For serious injuries, though, it is best to treat the victim at the accident site, provided that doing so would not further endanger the victim or the first aiders, and send 2 or more people for help. Write a note containing the following information and send it with the messengers: the location of the victim, description of the injuries or illness, time the injuries or illness occurred, treatment that the victim has received, the number of people with the victim and their general skill level for first aid, requests for special assistance or equipment, including food, shelter, or care for non-victims. Activities on open water sometimes take people far from any help. Larger boats often have radio equipment that can be used to summon aid. When phones or radios are not available, however, passengers will need to make and carry out a plan for getting help. Such a plan might involve sending 2 people to the closest telephone to call for help. In case of emergency, many people carry mobile phones these days, but not everyone carries details of whom should be called on their behalf in case they're involved in a serious accident. If you add the acronym ICE, ICE, for in case of emergency as a contact in your mobile phone, emergency workers can quickly find somebody to notify about your condition. Ask your parent whom to list as your ICE contact. Approach safely. After assessing the situation and summoning help, determine the best way to reach the injured person or persons. Perhaps an accident victim is lying on a busy highway or has fallen and tumbled partway down a mountainside. Will you also be in danger if you dash onto the highway or rush down the slope? Figure out a safe way to approach the victim or to remove the dangers from an area. Do not become an accident victim yourself. Once you have figured out the safest way to approach, introduce yourself to injured persons and to bystanders. Assure them that medical professionals have been called and are on the way. Speaking in a calm voice, explain that you are a scout trained in first aid and that you are there to help. Ask the victims if they will allow you to assist them. If the victim is unconscious, you have, quote, implied, unquote, consent to help them. If people are with an unconscious victim, be sure to tell them what you plan to do. If the victim is under 18, always get permission from a parent, guardian, or adult if one is present. Continue to speak to injured or ill persons as you administer first aid, keeping them informed of what you are doing. A person may appear to be unconscious, but may still be able to hear you. Triage. Emergency situations involving more than one victim can require triage. Quickly checking each victim for injuries or symptoms of illness and then determining how best to use available first aid resources. In its simplest form, triage occurs whenever first aiders approach an emergency scene that involves 2 or more persons who are injured or ill. Once on the scene, medical professionals will determine who requires urgent care, who can be treated later, who needs to be monitored in case his or her condition changes, and who is well enough to help out. Sometimes a victim's location threatens his or her safety and that of the first aiders. For example, you're out hiking and a buddy falls into a stream or gets hurt while on an unstable boulder field or an avalanche slope. It might be necessary to move him to a safer location before first aid treatment can begin. To move him, get the help of several others in your group and lift the victim in the same position in which he was found. Then carry him to safety and gently put him down. Take special care to prevent his neck from moving by supporting his head before, during, and after the emergency move. Now remember, do not move the victim unless you absolutely have to for safety reasons. Protect yourself. It's impossible to know for sure if the victim has any diseases. Professionals such as EMTs or emergency medical technicians and paramedics practice something called universal precautions. You should too. Consider all body fluids to be infectious. Minimize contact with them by wearing non-latex gloves. And if you might be splashed by blood, vomit, or other body fluids, also wear a protective mask and eye shield. Your sunglasses, rain gear, and bandana or neckerchief over your mouth and nose would work if nothing else is available, and you feel you might need it. Provide urgent treatment. Breathing and bleeding. These are your immediate concerns when treating the victim of an accident or illness. Victims who have stopped breathing or who are bleeding severely are called hurry cases because their lives are in imminent danger. They require smart, timely action on the part of a first aider. Whenever you come upon an injured person, take no more than 15 to 20 seconds to do a quick survey of his or her condition to find out the following. Is the person conscious and breathing? If he or she seems to be unconscious, tap the person on the shoulder and ask or shout if he or she is all right. If the person does not respond, stabilize the head and the neck if you suspect injuries and perform compressions, only CPR if the person is not breathing. Then place your ear near the mouth and nose where you can hear and feel the movement of air and watch for the chest to rise and fall. Is there severe bleeding? Open rain gear and outer clothing that might hide wounds from view. Quickly look and feel under the body and legs for bleeding. Are there any other contributing factors? Look for a medical ID bracelet, necklace, or card that might give any information about allergies, diabetes, or other possible causes of an emergency situation. Persons who have asthma or allergies to insect stings or certain foods, such as peanuts, might carry treatment for their condition. Protect from further injury. An important part of first aid is protecting an accident victim from further injury. Follow these guidelines. Avoid moving an injured person unless his or her body position makes it impossible to perform urgent first aid or he or she is in a dangerous location. If a person's position must be adjusted, for example, to allow them to breathe, do so with a minimum amount of movement. Stabilize the victim's head and neck to prevent any neck bones that may be broken from damaging the spinal cord. Ask a fellow first aider or a bystander to hold the victim's head and neck steady to keep the neck in proper alignment. Treat every accident victim for shock. The circulatory system of a person who is injured or under great stress might not provide enough blood and oxygen to the tissues of the body. This condition is called shock, and it can be deadly as organs begin to fail. Shock victims can have some, all, or none of the following symptoms: restlessness or irritability, a feeling of weakness, confusion, fear, dizziness, skin that is moist, clammy, cool, and pale, a quick, weak pulse, shallow, rapid, and irregular breathing, nausea and vomiting, and extreme thirst. Serious injuries and sudden illnesses are almost always accompanied by some degree of shock, but the victim might not be affected right away. Treat every accident victim for shock even if no symptoms appear. Prompt first aid may prevent shock from setting in. Fear and uncertainty can increase shock. In a calm voice, assure the person that everything possible is being done and that help is on the way. A person who appears to be unconscious may still be able to hear you. Never leave an accident victim alone unless you must briefly go to call for help. First aid for shock. Try to eliminate the causes of shock by restoring breathing and circulation, controlling bleeding, relieving severe pain, and treating wounds. Call or send someone for help. Monitor the victim closely to make sure the airway stays open for breathing. If the victim is not already doing so, help the injured person to lie down. If you do not suspect back, neck, or head injuries or fractures in the hip or leg, raise the feet about 12 inches to move blood from the legs to the vital organs. Keep the victim warm with blankets, coats, or sleeping bag. Number 7. Make a thorough examination. By the time you have dealt with urgent conditions and provided treatment for shock, medical professionals are likely to have arrived. When their arrival is delayed or the location will require greater travel time, conduct a more thorough examination to be sure you have found all the victim's injuries that require attention. If the victim is alert, ask him where it hurts and whether the victim can move his arms, legs, and so on. Look for DOTS, D-O-T-S. As you make this secondary examination of the victim from head to toe, D, deformity, O, open wounds, T for tenderness, and S for swelling. Number 8. After conducting the examination, the best course of action in most cases is to make the victim comfortable and continue to wait for medical help to arrive. In the backcountry, it may be wise to set up camp and shelter the victim with a tent. Rather than lifting a badly injured person into a tent, you can slit the floor of a standing tent and then place the tent over the person. Beware of your own needs, too, and those of others around you. Stay warm and dry. If a first aid emergency lasts very long, be sure to eat and drink enough. Be aware that other group members may be frightened or disoriented by what they've seen. Be sure they do not wander off. Giving people specific responsibilities, fixing a meal or making the camp, for example, can focus their attention and help keep them calm. First aid supplies and skills. You cannot render first aid if you do not have the tools and supplies necessary to treat an injured or ill person. A well-stocked first aid kit is an essential item for all first aiders. Equally important is learning and practicing difficult first aid skills such as how to safely transport an ill or injured person or an accident victim. A personal first aid kit, you will need to carry a few first aid items on hikes and campouts that will allow you to treat scratches, blisters, and other minor injuries to provide initial care for more serious emergencies. You should be able to fit everything in a resealable plastic bag. Always take your personal first aid kit when you set out on a scout adventure. Your kit should include, as a minimum, the following. You need to have adhesive bandages, at least 6, sterile gauze pads, 3 by 3 inch, 2, adhesive tape, a small roll, moleskin, 3 by 6 inch, 1, soap, a small bar or alcohol-based hand sanitizing gel, 1 travel size bottle, triple antibiotic ointment, a small tube, a pair of scissors, non-latex disposable gloves, a CPR breathing barrier, and pencil and paper. Home or patrol troop first aid kit. A more comprehensive first aid kit suitable for home use or use by your patrol or troop can treat a wide range of injuries. After assembling your home kit, be sure everyone in your family knows where the kit is being stored. It is also a good idea to carry a first aid kit in the car in case of roadside emergencies. On scout outings, the patrol or troop first aid kit can be carried in a fanny pack that is marked so it will be easy for anyone to locate. And at a minimum, the kit should contain the following: roller bandage, 2-inch, should be one, a roller bandage 1-inch, 2 of them, adhesive tape 1-inch, 1 roll, alcohol swabs 24, assorted adhesive bandages 1 box, elastic bandages 3-inch wide, 2 of them, sterile gauze pads 3x3, 12, moleskin 3x6-inch, you should have 4 of those, gel pads for blisters and burns, 2 packets, triple antibiotic ointment 1 tube, triangular bandages, you should have 4, soap, a small bar or an alcohol-based hand sanitizing gel, 1 travel size bottle, 1 pair of scissors, a pair of tweezers, safety pins, you should have 12 of those, non-latex disposable gloves, 6 pair, protective goggles, 1 pair, CPR breathing barrier 1, and of course pencil and paper. Moving an ill or injured person. The decision to move an accident victim should be made carefully. In many cases, there will be emergency medical crews, fire department personnel, or others with special equipment and training who will transport an injured person. If, however, someone is in danger from fire, smoke, water, electrical hazard, poisonous gases, exposure, or other immediate danger, you must move that person to safety. You might also need to move an injured person in order to give that person proper care or reach another victim. Move the person only as far as necessary and do not endanger yourself or others. Sometimes you will find a victim's injuries are minor enough that the person can move with some assistance. Before attempting to move someone, make sure the person is not suffering from any of the following conditions, and then determine the best technique to use for moving the victim or whether the victim should not be moved at all. And you're looking at someone that has shock, a heart attack, head, neck, or back injury, spinal injury, frostbitten or burned feet, a bone or a joint injury at the hips or below. For a victim of a venomous bite or sting, getting the victim medical attention is the most important goal. This may call for moving the victim before the swelling becomes too severe. If the bite is on an arm or a leg, try to minimize movement of this extremity as much as possible. Here are some additional assists and hand carries to consider. Some can be performed by a single rescuer, while others require 2 or more rescuers. Practice single and multiple rescue assists first with an uninjured person. This will help you work smoothly and safely during a real emergency. Signals include both signs, what you observe, as well as symptoms, what a person would communicate to you. Single rescuer assists. When an injured person must be moved, choose the method carefully to avoid making the injuries worse and to avoid injuring yourself. Recommended assists for a single rescuer include the following. They have a walking assist. If the victim is conscious and has only minor injuries and can move, you can safely help the person walk. Put one victim's arm around your neck. Hold that hand. Place your other arm around a person's waist. Ankle drag. This is the fastest method for a short distance on a smooth surface or to move someone who is too large or heavy to transport in any other way is to drag the person by both ankles. Shoulder drag for short distances over a rougher surface, and to move a conscious or unconscious person who may have neck, head, or back injuries using the clothes drag. Firmly grab the person's clothing behind the shoulder neck area and pull head first, and cradle their head in your arms. A blanket drag. You can roll the person onto a blanket, coat, tarp, or tablecloth, cover the person, and if possible, drag them from behind the head. The one person lift. You may be able to carry a child or someone who does not weigh much if you place one arm under the victim's knees, one around the upper back, and do not use this method if you suspect a spinal injury. You got the firefighter carry. To travel longer distance, carry the victim over your shoulder if injuries will allow it. The firefighter carry should never be used if you suspect that the victim has a spinal injury. There's a pack strap carry. The pack strap carry is better for longer distance than the one-person lift, and when the firefighter carry is not practical. You use this method only if you do not suspect a spinal injury. Multiple rescuer assists. Recommended assists for 2 or more rescuers include the following. Helping the person walk. If the victim is conscious and shows no signals of the conditions or injuries listed earlier, 2 rescuers can safely help the person walk. Put one of the victim's arms around each other's neck and hold the hands. Rescuers can place their free arms around the victim's waist. They have a 4-handed seat. When no equipment is available, the 4-handed seat carry is the easiest for 2 rescuer carry. It's safe only if the victim is conscious and can hang on. 2-handed seat. Use this method if the victim is conscious but not seriously injured. Rescuers place arms on each other's shoulder and lock arms for stability as the victim gets into position, then move arms from shoulders to across the victim's back. The chair carry. This is a good method for carrying an injured person upstairs or through narrow winding spaces. The hammock carry takes 3 to 6 rescuers to stand on either side of the victim and link hands and beneath the person. Rescue from a smoke-filled room. A smoke-filled room is an extremely hazardous environment. Rushing into a smoke-filled room or other dangerous scene to help someone will do no good if you also become a victim. If your safety will be threatened, wait until trained rescuers arrive. Moving an injured or unconscious person should be done quickly. Avoid using any method that might make the victim's injuries worse. A victim can be moved to safety with any of the rescuer assists that were described previously. Transportation by stretcher. When a person must be moved for some distance or his or her injuries are serious, you should carry the person on a stretcher. When available, use a litter or a rescue basket made especially for transporting injured persons. If none is available, make one of the following improvised stretchers and use the method shown in the illustrations to place the victim on an improvised stretcher. They have a shirt stretcher. Make a stretcher of 2 poles longer than the victim is tall, for example. Strong branches, tool handles, oars, or poles from a wall tent. Secure 2 scout shirts inside out with the buttons all buttoned over the poles to form a stretcher. If possible, overlap the bottoms of the shirts to give more secure bedding. Blanket stretcher. Place a pole on the blanket, fold over 2/5 of the blanket, place a second pole 6 inches away from the edge of the folded over part. Bring the edge of the blanket over the pole. Fold over the rest of the blanket. The person's weight will keep the blanket from unwinding. Have a board stretcher. Use a surfboard, door, bench, or ironing board, anything like that. A board stretcher is sturdier than a blanket stretcher, but heavier and less comfortable for the victim. When two rescuers carry a stretcher, have one or two other rescuers, if available, to walk at the sides to share the weight and help keep the victim from rolling off. Transporting someone by stretcher or improvised stretcher can be difficult and exhausting work, requiring at least 4 rescuers. Stretcher bearers should trade off with each other to conserve their strength. At least one first aider should stay by the victim's head at all times to monitor the person's condition and note any changes. To place someone on a stretcher or improvised stretcher, have 3 rescuers hold the victim straight and steady. A 4th rescuer can slide the stretcher beneath the victim. Gently place the victim on the stretcher. The rescuers can lift and carry the stretcher. If only 3 rescuers are available, they may try the hammock carry without a stretcher. First, they should position themselves at the victim's shoulders, torso, and legs to achieve full support. Then they should lift and carry the victim, being sure to support the head, arms, and legs. And a stretcher can be formed by lashing 3 metal pack frames together. To work well, the frames must have roughly the same width, and use sleeping bags for padding. Minor wounds and injuries. Although you should be prepared to deal with a wide range of medical emergencies, your first aid skills will probably be put to use most often in the treatment of relatively minor wounds and injuries. Remember to protect yourself with non-latex gloves and other universal precautions as needed, as well as by washing your hands before and after treating your patient. Bruises. The black and blue mark that is typical of a bruise is caused by blood leaking into skin tissues, often as a result of a blow from a blunt object. The skin is not broken. Some bruises are indicators of more serious injuries, including fractured bones or damage to internal organs. This type of bruise requires the attention of a medical doctor. Most bruises, however, can be treated by a person trained in first aid. To treat a bruise, place some ice, preferably, or a refreezable gel pack in a plastic bag or a damp cloth. Place a towel or clean cloth over the bruised area and apply the ice pack for periods of no more than 20 minutes. This treatment will slow blood from leaking into the tissues. Minimizing movement of the affected area also slows bleeding into the bruise. Puncture wounds. Puncture wounds. Puncture wounds can be caused by pins, splinters, nails, or fish hooks. All can be dangerous because the nature of a puncture wound makes it hard to clean and easily infected. To treat a puncture wound, help flush out dirt or particles that may have been forced inside the wound when the injury occurred by holding the injured area under clean running water for about 5 minutes. Use sterilized tweezers to pull out splinters, bits of glass, or other small objects you can see. If a large object is embedded, do not try to remove it. Control any bleeding and stabilize the object with rolled or folded sterile gauze pads. Apply a sterile bandage, secure the object in place, and get the victim to a doctor. A fish hook in the skin. A fish hook embedded in the skin is a frequent outdoor injury. Remember 2 things. Do not try to remove a fish hook from the face or from an eye or an earlobe, and never try to remove an embedded hook by pulling it back the way it went in. Cut the fishing line and, if possible, let a doctor remove the hook from the flesh. If that isn't possible, you might have to do the job yourself. First, wash your hands with soap and warm water, or use an alcohol-based sanitizer. Wear non-latex disposable gloves and protective eyewear to avoid contact with blood. Step 1. Wrap a 3-foot length of fishing line around the bend of the hook as shown in the illustration, and securely wrap the ends around your middle or index finger. Step 2. Keep the affected body part flat and stable. Then gently push down on the shank to free the barb from the injured tissue. The shank should be parallel to the injured tissue. Step 3. Keep bystanders well away from the area. Give the line a quick, sharp jerk and be careful to avoid getting snagged by the oncoming hook. Step 4. Wash and bandage the injury and keep the wound clean. Apply triple antibiotic ointment if there are no known allergies or sensitivities to the medication. See a doctor as soon as possible because the risk of infection is high with this type of injury. If the hook has lodged so that the barb is visible above the skin, you can try this method. Cut off the barbed end with wire cutters or pliers. Back the shank of the hook out through the entry wound because the risk of infection is high, and with any type of puncture wound, be sure to see a doctor as soon as possible. Cuts and scrapes or abrasions. Cuts may be caused by knives, razors, or broken glass, or any other sharp object. An abrasion is a wound that occurs as a result of the outer layers of skin being rubbed or scraped off. Abrasions may happen when the skin is scraped against a hard surface, for example, when a bicyclist falls to the pavement. The wound may not bleed very much. The greatest danger lies in contamination and possible infection of the wound. To protect yourself from cuts and scrapes, dress appropriately for the activity. For instance, jeans, boots, gloves, long-sleeve shirt. A few simple precautions can help you avoid the pain of the treatment and the healing process. A minor cut or scrape by flushing the area with clean water for at least 5 minutes, or until all foreign matter appears to be washed away. You may need to scrub the area gently. Apply triple antibiotic ointment if the person has no known allergies or sensitivities to the medication, and then cover with a dry, sterile dressing and a bandage or with an adhesive bandage. Dressings and bandages. After cleaning a wound in which the skin has been broken, protect it with a dressing. A dressing is a protective covering placed over a wound that helps to control bleeding and absorb blood and wound secretions. Sterile dressings are free from germs and should be used to dress wounds whenever possible. If a sterile dressing is not available, use the cleanest cloth you have. A bandage is a strip of material used to hold a dressing or splint in place. It helps immobilize, support, and protect the injury. Common bandages include rolls of gauze, elastic bandages or ace wraps, and triangular bandages. Combination dressing bandages include adhesive strips with attached gauze pads. Secure the dressing with a bandage or a tape. Watch for swelling, color changes, or coldness of the fingertips or toes. If any of these symptoms appear, it is a signal that circulation is being compromised. Loosen the bandages if the victim complains of tingling or numbness. When using a bandage to secure a dressing, be sure not to wrap it too tightly. Be sure the person's fingertips or toes are accessible when a splint or a bandage is applied to the arm or leg, so you can check for circulation beyond the injury. When the weather is cold, keep the victim's hands and feet covered with mittens or socks. Remove mittens or socks frequently to check that circulation is not being restricted. To dress and bandage a wound, use a dressing large enough to extend an inch or more beyond the edge of the wound. Hold the dressing over the wound and lower it directly into place. If the dressing slips onto the surrounding skin before it has been anchored, discard it and use a fresh dressing. Blisters on the hand and the foot. Blisters are pockets of fluid that form when the skin is injured by friction. Foot blisters are common injuries among backpackers, whereas blisters on the hands might be more common among canoeists. To help prevent foot blisters, wear shoes or boots that fit. Change socks if they become sweaty or wet, and pay attention to how your feet feel. To help prevent blisters on the hands, wear gloves for protection and pay attention to how your hands feel. Blisters are best left unbroken. If a blister does break, treat the broken blister as you would a minor cut or abrasion. And diabetics who develop blisters should see a doctor. A hot spot. The tender area as a blister starts to form is a signal to stop immediately. To treat a hot spot or a blister, cover the pinkish tender area with a piece of moleskin or mole foam slightly larger than the hot spot. Use several layers if necessary. There are a couple of helpful new products on the market, Second Skin and Blistaban, that may be worth trying. Follow the manufacturer's instructions. Change bandages every day to help keep wounds clean and avoid infection. If you must continue your activity even though you think a small blister will burst, you might have to drain the fluid. First, wash the skin with soap and water, then sterilize a pin in the flame of a match. Prick the blister near its lower edge and press out the fluid. Keep the wound clean with a sterile bandage or gel pad and moleskin. Protection from blood-borne pathogens. Whenever you provide first aid care, no matter how minor the wound or injury, you should take steps to protect yourself and others from blood-borne pathogens, viruses, or bacteria carried in the blood that can cause disease in humans and may be present in the blood or other body fluids of the victims that you treat. Blood-borne pathogens include the human immunodeficiency virus, HIV, which causes AIDS, and the hepatitis B and C viruses, which cause liver disease. Recommendations from the Boy Scouts of America: treat all blood as if it were contaminated with blood-borne pathogens. Thoroughly wash your hands with soap and warm water before and after treating a sick or injured person. Never use your bare hands to stop bleeding. Use a protective barrier, preferably non-latex disposable gloves. A new, unused plastic food storage bag will work in a pinch. Safely discard all soiled gloves, bandages, dressings, and other used first aid items by putting them in a double bag until they can be disposed of properly in a receptacle for biohazards. Always wash your hands and other exposed skin with soap and water or an alcohol-based hand sanitizer immediately after treating a victim, even if protective equipment was used. In some situations, such as a life-threatening one, it might not be possible or practical to spend 15 or 20 seconds washing your hands. You do the best you can and use your good judgment. Muscle, joint, and bone injuries. Muscles, joints, and bones are all involved in helping the body move. Falls, slips, collisions, and even fatigue and dehydration can compromise or injure these body parts. Muscle cramps. A muscle cramp occurs when a muscle contracts on its own and does not easily relax. They tend to happen most when the body is fatigued and when the muscles have not been stretched well. Dehydration, exertion in hot water, and depletion of electrolytes such as calcium, chloride, phosphate, potassium, and sodium in the body may also lead to muscle cramping. With severe cramping, the muscle may feel hard and knotted. Allow a person experiencing muscle cramps to rest. Often a cramp will disappear on its own within a few minutes. To help recovery, gently massage the muscle and lightly stretch it. If the weather is warm and the person has been exercising, be sure the person rehydrates with water or, ideally, a sports drink that will help the body and restore its proper electrolyte balance. Muscle cramps most often affect the legs, but they can also occur in the muscles of the ribs, arms, and hands. Decrease the likelihood of muscle cramps by staying in good physical shape, stretching before exercising, warming down, and drinking plenty of fluids before, during, and after you work out. Sprains and strains. A sprain occurs when an ankle, wrist, or other joint is bent far enough to overstretch the ligaments, the tough bands that hold the joints together. Twisting an ankle while running is one way a person can sustain a sprain. A strain occurs when muscles are overstretched, creating tears in the muscle fibers. Lower back pain is often the result of muscle strain by overuse or lifting loads that are too heavy. Minor sprains and strains cause only mild discomfort, but more serious sprains and strains might be temporarily disabling. A sprained joint will be tender and painful when moved and might show swelling and discoloration. Strained backs, arms, and legs will also be tender and can hurt if activity continues. Assuming that any injury to a joint also may include a bone fracture. Use the following procedure to treat sprains and strains and prevent further injury. Have the victim take any weight off the injured joint and instruct the person not to use the joint. Do not try to move or strengthen an injured limb. Cover any open wounds with a sterile dressing. Apply ice packs or cold compresses to the affected area for no more than 20 minutes at a time. Be sure to place a barrier such as a thin towel between the ice pack and the bare skin. Seek medical treatment if the pain is persistent or severe. There is an acronym that you can use. It's called RICE, R-I-C-E. Use it for bone, joint, and muscle injuries. Broken or dislocated bones should also be splinted. R, rest. Stop using the injured part or minimize its use. I, ice. Apply cold as soon as possible for 20 minutes and continue several times a day as needed. C, compression. Apply an elastic bandage to reduce swelling. E, elevation. If possible, keep the injured part above the level of the heart to reduce swelling and pain. Sprains while hiking. If someone suffers an ankle sprain during a hike and your group must keep walking, do not remove the hiking boot from the injured foot. The boot will help support the ankle. If you do take the boot off, the injury may swell so much it will be not possible to get the boot back on. Reinforce the ankle by wrapping it, boot and all, with a bandage, neckerchief, or some other strip of cloth. And as soon as you've reached your destination, have the person take off the boot, treat with cold packs, and seek medical care. Broken bones. A fall, a violent blow, a collision. All these can cause a fracture or a broken bone. When you suspect a fracture, do not move the person. Check for dots. Look for an abnormal shape or position of a bone deformity, an open wound, tenderness, or a bluish color at the injured site. Ask the victim these questions, of course, if they're conscious. Did you hear or feel a bone snap? Do you feel pain when you press on the skin over the suspected fracture? Are you unable to move the injured limb? If the victim answers yes to these questions, the person likely has a fracture. Before administering first aid, you should try to obtain the victim's consent. If the victim is unconscious, disoriented, or otherwise appears unable to knowingly grant consent, you can assume that it is all right to proceed. A closed or a simple fracture. A closed fracture, also known as a simple fracture, is a broken bone that does not cut through the skin. For a closed fracture, do the following. Call 911 or your local emergency response number. Treat hurry cases. No signs of life, movement, and breathing. In adults, in children, and infants, no signs of life and no pulse. Protect the spinal column by supporting the victim's head and neck in the position found. Treat for shock, but avoid raising a leg that might be broken. Open fractures or a compound fracture. This involves an open wound that could occur from either the bone breaking the skin or an object going into the skin to break the bone. Take the following actions for an open fracture. Call 911 or your local emergency response number. Treat hurry cases. No signs of life, movement, and breathing in adults and children and infants. No signs of life and no pulse. Protect the spinal column by supporting the victim's head and neck in the position found. Control bleeding by placing a sterile gauze around the wound as you would for an embedded object. Do not use direct pressure as that could move the bone. Do not try to clean the wound. Treat for shock, but avoid raising a leg that might be broken. Whether you are treating a closed or open fracture, allow the person to lie where you found him or her, unless the site poses an immediate hazard to the victim or rescuers. Make the person comfortable by tucking blankets, sleeping bags, or clothing under and over the body. Splints. If the victim must be moved, splinting a broken bone can help relieve pain and reduce the chances of additional injury. A splint is any material, soft or rigid, that can be bound to a fractured limb. Use splinting only if necessary to stabilize the injured area and prevent it from moving and causing further injury and pain. Make the splint long enough to immobilize the joints above, below, and on either side of a fracture as needed. Make splints from whatever is handy: boards, branches, blankets, hiking sticks, ski poles, shovel handles, tent pole sections, folded newspapers, magazines, or pieces of cardboard, or a sleeping pad will work too. Take enough time to design an effective splint and secure it with good knots to provide enough support. Padding allows the splint to fit better and can make the victim more comfortable. Cushion a splint with clothing, blankets, pillows, crumpled paper, or other soft material. Hold the splints and padding in place with neckerchiefs, handkerchiefs, roller bandages, or other wide strips of cloth. How to splint an injured limb. Splint all fractures and suspected fractures in the same position as you found them. Do not try to straighten or reposition the injured area. Keep the area above and below the injury still and stable. 2. Check for circulation, feeling, warmth, and color. 3. Extend the splints beyond the joint above and the joint below the suspected injury. Minimize movement while applying the splints by providing support above and below the fracture. Step 4. Secure splints with bandages, neckerchiefs, or other wide strips of cloth. Tie at least one place above the injured area and one below. Do not tie bandages directly over the injury itself or over a joint. After the splint is in place, recheck for circulation, feeling, warmth, and color to make sure you haven't cut off circulation. Soft splint on the lower leg. When applying a soft splint on the lower leg, do not remove the injured person's shoe. It will provide support and help control swelling. Step 1. Support the injured area above and below with one hand under the ankle and the other hand keeping the foot upright. Step 2. Without removing the shoe, carefully check for circulation, feeling, warmth, and color. Step 3. Position several triangular bandages under the injured area. Step 4. Gently wrap something soft, a small blanket or a towel, around the injured area. Tie the triangular bandages in place securely with knots. Recheck the area for circulation, feeling, warmth, and color. No circulation is an indication that the bandage is too tight and should be loosened. A lower leg fracture. Use splints that are long enough to reach from the middle of the thigh to past the heel. Place one splint on each side of the injured limb and bind them together. An upper leg fracture or a femur. Apply 2 padded splints, one outside the leg extending from heel to armpit and the other inside the leg from the heel to the crotch, and bind the splints together. The muscles of the upper leg are strong enough to pull the ends of the broken thigh bone into the flesh, sometimes causing serious internal bleeding that may pose a threat to the victim's life. For this reason, in addition to the first aid described here, for a thigh bone or a femoral fracture, treat this injury as a hurry case. Call for medical help immediately and keep the victim still and quiet. Control any bleeding and treat for shock. Slings help support an injured hand, arm, collarbone, or shoulder. Support the injured limb above and below the injured area. Check the injured area for circulation, feeling, warmth, and color. Position a triangular bandage or a sling as a folded scout neckerchief or a large triangular bandage across the chest. If one is available, place a clean gauze bandage over the side of the neck for comfort at the area where the sling will be knotted. Bring the upper free end of the sling behind the neck and the lower free corner upward as shown, and tie the ends together with a square knot forming the sling. Step 5. To keep the injured area more stable, bind the sling to the chest using a second triangular bandage. Roll the bandage up as shown. Comfortably, but not too loosely, position the bandage above the injured area over the sling and access the victim's front. Bring one end of the rolled up bandage under the victim's uninjured arm and the other side around to the back. Tie the ends together with a square knot and put a clean gauze pad under the knot for comfort. And recheck the injured area for feeling, warmth, and color. Head, neck, and back injuries. The backbone or spinal column is made up of small bones called vertebrae that surround and protect the spinal cord. If a vertebrae is broken or dislocated, the spinal cord may be injured. Fractures of the head, neck, and back are extremely dangerous because movement might further damage the spinal cord and cause permanent paralysis or even death. Whenever someone has fallen, been involved in an automobile accident, or suffered a blow to the head, assume there is an injury to the head, neck, or back. Such injuries are often not easy to detect. The victim may or may not be suffering from pain, paralysis, cuts and bruises, or swelling. The injured area may be deformed or abnormally shaped, or there may be no symptoms at all. Someone with a head injury might be disoriented, irritable, confused, or combative, symptoms that can be present right away or might develop over time. Always proceed with great caution when you are aiding a person whom you suspect has head, neck, or back injuries. It's safe to suspect possible head, neck, or back injury when the victim has been in a motor vehicle crash, has fallen from a higher than a standing height, is or was wearing a safety helmet that is broken, complains of neck or back pain, feels tingly or weakness in the fingers or toes, is not fully alert, appears to be confused or drunk, and appears to be frail over 65 years of age. When you suspect an injury to the head, neck, or back, follow these steps. Step 1. Stabilize the head and neck of the victim until it can be determined whether the spinal column has been injured. A first aider or a bystander can hold the victim's head and neck steady. If the person is wearing a helmet, do not remove it unless it is necessary to access the person's airway. Provide urgent treatment if necessary. Do not move the person or let him or her move unless threatened by an immediate danger such as a fire, potential avalanche, or highway traffic. If the victim is having trouble breathing, gently adjust the position of the head and neck just enough to maintain an open airway. Do not put a pillow under the head. Treat for shock, but do not unnecessarily change the victim's position. Whenever you suspect head, neck, or back injuries and the victim must be moved to open an airway, for example, or to get the person out of the path of danger, ask other scouts or bystanders to help so that the victim's body can be turned or lifted all at once without causing any twists or turns. Cold and heat-related conditions and injuries. The human body works best if it has a constant temperature of 98.6 degrees. A person who is exposed to cold environmental condition and loses body heat faster than it can be regenerated will be in grave danger. The person's body temperature may become too low to support life. Likewise, a person whose body has overheated and cannot cool itself sufficiently may die if fast emergency medical care cannot be found. These temperature-related emergencies require fast, life-saving first aid. Hypothermia. Hypothermia occurs when a person's body is losing more heat than it can generate. It is a danger for anyone who is not dressed warmly enough, although exposure to cold is seldom the only cause. Dehydration is a common contributing factor to hypothermia. Wind, rain, hunger, and exhaustion can further compound the danger. Temperatures do not need to be below freezing either. A hiker caught out in a cool, windy rain shower without proper rain gear can be at great risk. A swimmer too far out in chilly water or a paddler who capsized also is at risk for hypothermia. First aid for hypothermia. A hypothermia victim may experience numbness, fatigue, irritability, slurred speech, uncontrollable shivering, poor judgment or decision making, and loss of consciousness. Shivering that stops without rewarming is a sign that the person's condition is worsening. He or she then needs immediate medical care. Treat a hypothermia victim by preventing the person from getting colder. After summoning help, use any or all of the following methods to help bring the body temperature back up to normal. If fully conscious and able to swallow, have the person drink warm liquids, soup, fruit juices, water, no caffeine, and no alcohol. Move the person into the shelter of a building or a tent. Remove wet clothing. Get him or her into dry, warm clothes, or wrap the person in blankets, clothing, or anything handy that could be used, like jackets or a sleeping bag. Wrap towels around water bottles filled with warm fluid. Then position the bottles in the armpit and groin areas. Monitor the person closely for any changes in condition. Do not rewarm the person too quickly, for instance, by putting the person or immersing the person in warm water. Doing so can cause an irregular and dangerous heartbeat. If one person is being treated for hypothermia, the rest of the group might also be at risk. So you need to protect yourselves by taking shelter, putting on layers of warm clothing, and having something to eat and something warm to drink. Frostbite. Frostbite is a condition that occurs when the skin is exposed to temperatures cold enough that ice crystals begin to form in the tissues. A frostbite victim might complain that the ears, nose, fingers, or feet feel painful and then numb, but sometimes the person will not notice any such sensation. Grayish-white patches on the skin indicating that ice crystals have begun to form on the top layers of the skin are signals of the first stages of frostbite or frost nip. With continued exposure, frost nip worsens and the freezing extends to the deeper layers of the skin and to the muscles. Frostbite can be very serious, as it can cut off blood flow to the affected area and lead to gangrene or tissue death. Far from the warmth of the body's core, toes and fingers are especially vulnerable, as are the nose, ears, and cheeks. Dehydration increases the danger of frostbite, so cold weather travelers must be just as diligent about drinking fluids as they are when the weather is hot. First aid for frostbite. If you suspect that frostbite extends below skin level, remove wet clothing and wrap the injured area in a dry blanket. Get the victim under the care of a physician as soon as possible. Do not massage the area or rub it with snow. Rewarm the area only if there is no chance of refreezing. Expose the affected area to warm, that's 100 to 105 degree water until normal color returns and it feels warm, and bandage the area loosely, placing dry, sterile gauze between the fingers and the toes. To treat frost nip, move the victim into a tent or a building and then warm the injured area. If an ear or a cheek is frozen, remove a glove and warm the injury with the palm of your hand. Slip a frost-nipped hand under your clothing and tuck it beneath an armpit. Treat frost-nipped toes by putting the victim's bare feet against the warm skin of your belly. Dehydration. The human body is 70% water, which is essential to maintain our body temperature. Vital organs like the brain and the kidneys will not function well without enough water. We lose water mostly by breathing and sweating, digestion, and urination. When we lose more water than we take in, we become dehydrated. Signals of mild dehydration include fatigue, increased thirst, dry lips, and dark yellow urine. Signals of moderate to severe dehydration include severe thirst, dry mouth with little saliva, dry skin, weakness, dizziness, confusion, nausea, fainting, muscle cramps, loss of appetite, decreased sweating, even with exertion, decreased urine production, and less frequent and dark brown urine. So the importance of drinking plenty of fluids cannot be overemphasized. Don't wait until you feel thirsty. Thirst is an indication that you are already becoming dehydrated. Dehydration can play a significant role in a number of serious conditions, including heat exhaustion, heat stroke, hypothermia, and frostbite. Dehydration can happen in hot and cold weather conditions. To treat mild dehydration, drink plenty of water or a sports drink to replace fluids and minerals. Drink 1 to 2 quarts or liters of liquids over 2 to 4 hours. See a physician for moderate or severe dehydration. Severe dehydration requires emergency care. The victim will need intravenous fluids, rest for 24 hours, and continue drinking fluids. Avoid tiring physical activity. Although most people begin to feel better within a few hours, it takes about 36 hours to completely restore the fluids lost in dehydration. Heat exhaustion can be brought on by a combination of dehydration and a warm environment. Heat exhaustion is not uncommon during outdoor activities conducted in hot weather, especially if participants are not fully acclimated to the conditions. Signals of heat exhaustion include severe lack of energy, general weakness, headache, nausea, faintness and sweating, cool, pale, moist skin, and a rapid pulse. First aid for heat exhaustion: get the person into the shade or an air-conditioned vehicle or building. Encourage him or her to drink fluids such as cool water or a sports drink. Apply cool, wet towels or cloths to the skin. Wet the person's clothing with cool water and fan the person to keep the cooling process. Raising the legs may help prevent a feeling of faintness when the person stands. Usually, after 2 to 3 hours of rest and fluids, the victim will feel better, but should rest for the remainder of the day and be extra careful about staying hydrated. Heat stroke. Heat stroke, much more serious than heat exhaustion, can lead to death if it's not treated immediately. Left untreated, the heat exhaustion can develop into heat stroke. In heat stroke, the body's cooling system begins to fail and the person's core temperature rises to life-threatening levels above 105 degrees. One type of heat stroke develops in young, healthy people from dehydration and overexertion in hot weather, especially in high humidity. Signals of exercise-related heat stroke can include any signals of heat exhaustion as well as hot, sweaty, red skin, confusion, disorientation, a rapid pulse, shallow breathing, vomiting, and seizures. The other type of heat stroke usually happens in elderly people when the weather is very hot, and especially with high humidity. The signals are similar to exercise-related heat stroke, except that the skin is hot and dry because there is no sweating. First aid for heat stroke. Heat stroke is a life-threatening condition. Call for medical assistance immediately. While waiting for medical personnel to arrive, work to lower the victim's temperature. Move the person to an air-conditioned or shady area. Loosen tight clothing and further cool the victim down by fanning and applying wet towels. If possible, immerse or spray the person with cold water. If you have ice packs, wrap them in a thin barrier such as a thin towel and place them under the armpits and against the neck and the groin. If the person is able to drink, give small amounts of cool water. Burns. Sunburn is the most common type of superficial burn. A spark from a campfire, boiling water spilled from a pot, a faulty wire, a mishap with chemicals in a science class, the rays of the sun on bare skin, The causes of burns are many. Burns are generally characterized by degree or the severity of the skin and tissue damage. Superficial first-degree burns. Mild burns, such as you might get from touching a baking dish that has just come out of an oven, will cause a painful reddening of the skin. Such burns are classified as superficial or first-degree burns. They affect only the outer layer of skin or epidermis. Treat them by holding the burn under cold water or applying cool, wet compresses until the pain eases. Superficial burns do not usually require further medical treatment unless they cover more than 20 to 25% of the body. Sunburn is the most common type of a superficial burn. Remember to check the scene before you proceed, and always get the victim away from the source of a burn before proceeding with treatment. While the general public continues to be more familiar with the terms first degree, second degree, and third degree to classify burns, medical professionals identify burns by their thickness. For instance, minor or first degree burns are called superficial. Those that cause blistering of the skin, second degree, are called partial thickness burns. The most serious burns, third degree, are called full thickness burns. Partial thickness, second degree burns. A partial thickness or a second degree burn affects the epidermis and part of the layer of skin below it, the dermis. Partial thickness burns are more serious than superficial burns and typically include a reddening and blistering of the skin. Being scalded by boiling water is an example of an accident that could result in partial thickness burns. To treat such burns, first remove the person from the source of the burn. Cool the burned area with cold running water until the pain is relieved. Let the burn dry, then protect it with a loosely applied, sterile gauze pad and bandage. Do not apply ice or ice water to any burn. Doing so may cause the body to lose heat rapidly and further damage body tissues. Get immediate medical treatment for the victim if the burns cause trouble breathing, cover more than one body part or large surface, have caused possible burns to the airways, such as burns to the mouth and nose, affect the eyes, head, neck, hands, feet, or genitalia, are full thickness and the victim is younger than age 5 or older than 60. And if there are the results of chemicals, explosions, or electricity. Never break burn blisters. Doing so will create an open wound that may become infected. Do not apply butter, creams, ointments, or sprays. They are difficult to remove and may slow the healing process. Full thickness burns or third degree burns. Full thickness third degree burns are very serious and potentially life-threatening. They destroy the epidermis and the dermis. A victim who has been exposed to open flames, electricity, or chemicals may sustain full thickness burns. The skin may be burned away and the flesh charred. If nerves are damaged, the victim may feel no pain. Such burns constitute a medical emergency. Do not try to remove any clothing as it may be sticking to the victim's flesh. Cool the burn by applying cold, moist cloths. After cooling the burn, cover the burned area with a dry, sterile dressing, treat for shock, and seek immediate medical attention. Do not use any kind of an ointment on a severe burn. Chemical burns. Chemical burns can be caused by exposure to the skin or eyes to substances that are strong acids or strong bases such as mottled glue, drain cleaners, toilet bowl cleaners, metal cleaners, and battery acid. Here are steps for treating a chemical burn. Step 1. Using gloves or a piece of cloth, rub off powdered chemicals from the victim's skin. Remove any of the victim's clothing with chemicals on it. Do not contaminate yourself in the process. Step 2. Immediately flood the affected area with cool, clean water. Continue flushing the wound for at least 20 minutes to remove traces of the chemical. If the chemical got into the eyes, flush the eyes with clean water. It may be easier to have the victim lie down while flushing the eyes with water. Act as quickly as possible. Continue flushing for at least 15 minutes or until emergency medical professionals arrive. Step 4. Cover the burns loosely with a sterile dressing or gauze. And step 5, get medical help by calling 911 or your local emergency response number immediately. If you know the name of the product or substance that caused the burn, be sure to inform emergency workers. The damage from a chemical burn can take hours or even days to fully develop. For this reason, it is initially difficult to evaluate the extent of the burn. The most important first aid for a chemical burn is to dilute the exposure by continuously flushing the area with water for at least 15 to 20 minutes or until emergency medical help arrives. Remember also that inhaling chemicals can damage your airway and your lungs too. Burns from dry chemicals. As long as the dry chemical is on the skin, it will continue to burn. So, it's important to quickly brush off as much of the chemical as possible using a gloved hand. Then, flush the area with tap water, taking care not to recontaminate the victim or to contaminate yourself. Electrical burns. Never touch a person who is in contact with a live electrical power source. If electricity travels through a part of your body, you can get an electrical burn. Besides a burn, too much electricity can even stop the heart from beating correctly or damage other internal organs. Superficial and partial thickness burns from electricity look like burns from too much heat. The skin may look charred. Full thickness electrical burns may not leave charred skin. Instead, the skin can look leathery and white and be hard to touch. Call 911 or the local emergency response number if someone has an electrical burn. If you encounter a victim of an electrical burn, shut off the power at its source and call an ambulance immediately. Check the scene for safety and then take the following steps. Step 1. Begin CPR and get the automated external defibrillator, or AED, if you will, if it's available, if the victim is not breathing or moving. Step 2. Cover the burns with a sterile gauze pad. Cool electrical burns as you would for thermal burns. Step 3. Treat for shock. Sunburn. Sunburn is a common injury among people who enjoy being outdoors. Most sunburns are first-degree burns, but prolonged exposure to the sun can cause blistering, a second-degree burn. Repeated sunburns over a long period of time can cause skin damage and increase the risk of skin cancer. People with lighter skin are most at risk, although others are not immune. Treat painful sunburn as for any heat burn or with cool, damp, or wet cloths. Change the cloths frequently. Prevent further injury by getting the person under shade. If no shade is available or you are out on a hiking or boating trip, have the person wear a brimmed hat, pants, and a long-sleeve shirt for protection from the sun. It is best to prevent sunburn. Whenever you are outdoors, use plenty of sunscreen with a sun protection factor, that is an SPF rating of at least 15. Apply sunscreen liberally about a half hour before sunlight exposure and reapply every 2 hours, especially if you are sweating or have been in the water. A broad-brimmed hat, long-sleeve shirt, and long pants provide even more protection. And remember this, it's easy to forget the sunscreen in wintry conditions. Other first aid cases. As a first aider, you will encounter many relatively minor cases. Nevertheless, always take all injuries, illnesses, or conditions seriously. They can be signals of a more serious health threat. Abdominal pain, for example, could be among the first signs of appendicitis. A fainting spell could occur as a result of a heart attack, stroke, or internal bleeding. Many people have health conditions such as diabetes or epilepsy. Signs of these conditions can flare up unexpectedly and may require first aid. Whenever you prepare for a group outing such as a camping or canoeing trip, find out if participants have such conditions and have them inform group leaders of their health histories, treatment regimens, medications, and the locations of those medications. Any important medical information should be included on a medical ID bracelet. Fainting. Fainting is a brief loss of consciousness. It usually occurs because there is a temporary loss of blood flow to the brain. It can be caused by getting up too quickly or standing too long, by overheating or dehydration, by emotional stress such as fright or bad news, or by severe pain. Fainting occurs suddenly, or there might first be signals such as dizziness, nausea, paleness, sweating, numbness and tingling of the hands or feet, vision blackout or whiteout, and coldness of the skin. The victim might fall to the ground. If the person begins to feel faint, have him or her sit down with their head between the knees or lie down and raise the legs about 12 inches. Someone who has fainted should be encouraged to stay lying down until he or she awakens and feels better. Raise the feet and legs about 12 inches. Make sure the person's breathing passage, the airway, stays open. If the victim begins to vomit while lying down, turn them over to one side and keep the airway clear. Support the head with a pillow or let the victim rest on one arm. Loosen clothing around the neck. Wipe the victim's forehead with a cool, wet cloth. If the person is alert enough and might be dehydrated, you can give fluids to drink. If the person does not awaken within 2 minutes or so, or fully recover within a few minutes, then they get medical help. Hyperventilation. Hyperventilation happens when you are breathing faster and deeper than your body needs. Involuntary or unintentional hyperventilation may be caused by severe pain, infection, severe bleeding, heart attack, cold water immersion, diabetic coma, poisoning, or conditions such as anxiety attacks. The victim can feel dizzy or faint and have numbness, tingling, and or cramping in the fingers and toes. Involuntary hyperventilation usually requires immediate medical attention. Voluntary or deliberate hyperventilation is unhealthy and can be dangerous, especially if it is followed by breath holding. A person who does this can pass out or faint from lack of oxygen before he feels the need to breathe. If this occurs while a person is underwater, the result can be drowning. So be alert to abnormal breathing patterns in individuals. Loss of consciousness. A loss of consciousness for more than 2 minutes is a serious medical condition. An unconscious person might have been hit in the head or had a heart attack or a stroke. Diabetics can lose consciousness from either very high or very low blood sugar. Look for an emergency medical ID bracelet or necklace or an information card that identifies health problems such as diabetes. Follow the instructions on the card exactly. Whenever a person is unconscious for more than a minute or two, call 911 or your local emergency response number for medical assistance. Check to see if the person is breathing and for other signs of life. Begin CPR if appropriate. If there has been an accident, protect the victim's head and neck from movement. If the unconscious person has not been involved in an accident, look around the scene for evidence of poisoning, drug use, or other possible causes for the loss of consciousness. If you suspect a poison or drugs were involved, take the container or suspected poison to the emergency room with the victim. If the victim recovers before medical personnel arrive, he or she should seek medical advice as soon as possible. Any loss of consciousness after a head injury, even if it's only for a short time, requires immediate evaluation by a healthcare professional. Taking too many drugs or drinking too much alcohol can make a person lose consciousness. Never give an unconscious person anything to drink, throw water on the face, or offer stimulants such as smelling salts. Do not shake or slap the patient in an effort to wake him or her up. Seizures. A seizure is a change in awareness or behavior that is caused by abnormal electrical activity in the brain. In adults and children over age 6, seizures are usually due to epilepsy, which is a disorder of the brain. A seizure could be a signal of a serious medical problem. Seizures can occur in a person who is suffering from a head injury, brain tumor, stroke, poisoning, electrical shock, heat stroke, infection, a high fever, usually in children, low blood sugar, or low blood pressure. Epilepsy may be the cause of a seizure. There are several common forms of epilepsy. In grand mal epilepsy, known as a tonic-clonic seizure, the victim may lose consciousness and fall to the ground. The arms and legs stiffen, then jerk forcefully. Some muscles or the entire body can stiffen or twitch with sudden muscle spasms known as convulsions. The victim may bite the tongue. Do not put anything in the victim's mouth. Victims will rarely bite their tongues with enough force to cause bleeding. Neck veins may be swollen, and the face may turn red or blue. Breathing may decrease and is often loud and labored, accompanied by grunts or snorts with an unusual hissing sound. The victim may drool or foam at the mouth and may lose bladder or bowel control. Another kind of epileptic seizure is the petit mal seizure, in which the person seems to briefly lose awareness of his or her surroundings and appears to stare into space. This behavior is often mistaken for daydreaming. Although awake, the individual does not respond normally. Afterward, the person does not recall the incident. Focal seizures cause one part of the body to jerk or twitch, and the person seems distant or unaware. Seizures are frightening to observe. While there is no first aid measure that will stop a seizure, you can provide good first aid by protecting the person from being injured while experiencing a seizure. Break the person's fall if possible and lower him or her gently to the floor or the ground. Step 1. Move away any furniture and hard or sharp objects that could cause injury. Avoid moving the person unless there is a potential danger nearby, a fireplace, stairway, glass door, swimming pool, or other hazard. Loosen tight clothing around the neck and the waist. Do not try to hold the person. Trying to restrain someone during a seizure risks injury to that person and to the person that's giving the first aid. Do not force anything into the mouth or between the teeth. Make sure the airway is open after the seizure has stopped. Do not try to open the airway during the seizure. When the seizure is over, place the person in a recovery position. Let the person rest and keep curious onlookers away. If the person is not known to have epilepsy, and if the seizure lasts more than 5 minutes, recurs, or causes injury, or the person is slow to recover, call 911 or your local emergency response number. Calling for emergency assistance immediately if a seizure victim is pregnant, diabetic, unconscious, or injured, or has swallowed large amounts of water as a result of a water accident. Epilepsy is controlled by medications. While it may not always be necessary to call 911 for a seizure victim who has epilepsy, when in doubt, call 911. Regardless, a seizure victim may still need medical attention. Recovery position. Place a victim who is unconscious but who is breathing normally in a recovery position. To do this, extend the person's arm farthest from you up next to the head in line with his or her body. Bend the leg nearest you up. Support the head and neck as you grasp the victim's hip and shoulder and roll the person away from you so that he or she is lying on a side. This will prevent the person from choking on saliva, blood from a bitten tongue, or a vomit, and will keep the airway open. Continue to monitor the person's breathing until medical help arrives. You may need to turn a person who has been in a recovery position for 30 minutes or longer to the opposite side to stimulate circulation. However, do not move a person with a suspected spinal injury unless it is absolutely necessary. Diabetes is a disorder that impairs the body's ability to control its blood sugar level. In some cases, the body stops making insulin. Insulin is a hormone that helps the body use sugar for energy. Some people who have diabetes must inject insulin to live. For people with diabetes who do not have to use insulin, can keep their blood sugar at the proper levels by watching what they eat and taking other diabetic-controlled medicines. When a diabetic person's blood sugar level is too high or too low, the person can become unconscious. This is a diabetic emergency. A very high blood sugar level, or hyperglycemia, will rarely cause death. A low blood sugar level, which is hypoglycemia, is extremely dangerous because without sugar, brain cells die quickly and permanent brain damage can result. Because it is impossible to know if there is too much or too little sugar without doing a blood test, all unconscious diabetics should be treated as though their blood sugar levels are too low. A diabetic person may be wearing a medical ID necklace or have a bracelet or have a card explaining what would be done during a diabetic emergency. The person might also carry some form of concentrated sugar to be taken orally if low blood sugar is suspected. Follow the instructions exactly. Diabetics who use insulin sometimes have low blood sugar level without becoming unconscious. This can happen if they take too much insulin and don't eat enough food, exercise a lot without eating a snack, or if they decrease their dose of insulin ahead of time or wait too long between meals. With mild cases of hypoglycemia like these, and the victim is fully conscious and able to safely swallow food or drinks, give the victim some fruit juice or a soft drink that contains sugar, like a non-diet drink. Foreign object in the eye. Something in the eye is not just painful, it could endanger eyesight. The National Society to Prevent Blindness says that 90% of all eye damage is preventable. To protect your eyes, always wear safety glasses or goggles when using power tools, lawn and garden equipment, and other machinery that slings dirt and debris. Be careful not to let fumes from solvents and cleaning agents burn your eyes. If a foreign object gets in the eye, do not rub the eye. Rubbing might scratch the cornea, the clear covering of the colored part of the eye. Have the person blink the eye. Tears might flush out the object. If that doesn't work, wash your hands with soap and water, then try to flush out the foreign particles with clean running water or clean water poured from a glass or a bottle. Foreign matter that is embedded in the eye or that will not wash out must be treated by a physician. Stabilize the object if possible and cover the injured eye with a dry, sterile gauze pad and take the person to a doctor. When you're outdoors on windy days, help protect your eyes by wearing sunglasses. Nosebleeds might look bad, but they are normally not very serious and will usually stop in a few minutes. The bleeding usually stems from a small vein in the nose and can be caused by irritation to the area from colds, allergies, picking your nose, cold and dry weather, and overuse of nose drops or sprays. Have the victim sit leaning slightly forward so that the blood does not run down the throat. Ask the person to use the thumb and forefinger to pinch the nose firmly but gently and apply pressure on the upper lip just below the nose while the person is pinching, and apply a cold compress to the nose and the surrounding area. After about 10 minutes, have the person slowly release the nose pinch. If the bleeding reappears, pinch the nose and apply pressure once again. After the bleeding stops, do not irritate, pick, or blow the nose for several hours. If the bleeding continues for more than 15 minutes, you need to seek medical attention. For poisoning, call 800-222-1222. A poison is a drug, chemical, or toxic liquid that can cause illness or death if swallowed. Any drug or medicine can be poisonous if not taken according to doctor's instructions or the directions on the label. Many cosmetics, cleaning products, pesticides, paints, and other household products also contain chemicals that may be harmful if swallowed. Call the Poison Control Center toll-free at 800-222-1222 if you have a poisoning emergency. Keep the number handy, and meanwhile, follow these steps. Step 1, immediately take any poison containers to a telephone. Call the Poison Control Center at the toll-free number or 911 or your local emergency response number if a life-threatening condition such as unconsciousness, a change in consciousness, or no breathing is found, and follow the instructions that you are given. Step 2, treat the victim for shock and monitor breathing. Do not give anything by mouth unless you are told to do so by medical professionals. Step 3, save any vomit using a bowl, cook pot, or plastic bag. It will help a physician identify the poison and give the right treatment. Poisonous plants. The oily sap from the leaves, stem, and roots of poison ivy, poison oak, and poison sumac irritates the skin of most people. Once the sap gets on skin, it can spread to other parts of the body and cause a rash with redness, blisters, swelling, itching, burning, fever, and a headache. The severity of the reaction depends on the individual and the extent of the exposure. The best form of prevention is to learn how to recognize the poisonous plants in your area and avoid contact with them. Learn what poisonous plants look like and stay away from them. Leaflets 3, let it be, might help you remember to avoid plants that have leaflets grouped together in threes, such as poison ivy. White berries are another signal of poisonous plants, although not all plants with 3 leaves or white berries are poisonous. Wearing protective clothing like disposable coveralls, rubber-coated or non-latex gloves, and take care when handling tools, clothing, and gear that could be contaminated. The sap of these plants must be on your skin for 10 to 20 minutes before it starts to cause problems. So if you think you've touched a poisonous plant, immediately stop to wash the exposed area well with soap and water. Wipe with rubbing alcohol and apply calamine or other soothing skin treatment. If the reaction is severe, if the genital area is affected, if the plant parts were chewed or swallowed, or if contaminated smoke was inhaled, seek immediate medical attention. The sap also binds well to clothing, so change clothes. Keep the outfit you were wearing separate from your other clothing and wash it separately when you're back home. Abdominal pain. There are many causes of abdominal pain. It might be as harmless as an upset stomach or as dangerous as appendicitis. Always take complaints of abdominal pain seriously. Watch the person closely for increasing pain or changes in the level of consciousness. Many people who have appendicitis will have the same symptoms. First, there is a loss of appetite. Then a pain begins in the lower right quadrant of the abdomen and gets worse over several hours. Finally, there is nausea and vomiting. If you think someone might have appendicitis, do not allow the person to eat or drink. Call 911 or a physician immediately. Also, seek medical attention if someone suffering abdominal pain has a temperature of 102 degrees or higher, or if there are signals of blood in the urine, vomit, or in the stool. Dental injuries. A blow to the face can knock out a tooth or break a jaw. These dental injuries require immediate medical attention. However, an infected tooth with pain, fever, or swelling can be just as serious and also requires treatment without delay. Braces and retainers. If a wire is causing irritation, cover the end of the wire with a small cotton ball, beeswax, cold candle wax, or a piece of gauze until you can get the person to a dentist. If the wire is embedded in the cheek, tongue, or gum tissue, do not attempt to remove it. See a dentist or an orthodontist immediately. A bitten lip or tongue. Apply direct pressure to the bleeding area with a clean cloth. If swelling is present, apply a cold, wet cloth or pad. If the bleeding does not stop, the injured person should seek medical attention. Toothache. Have the victim rinse the mouth vigorously with warm water to clear out any debris. Use dental floss to remove any food that might be trapped between the teeth. If swelling is present, place a cold, wet cloth or pad on the outside of the cheek. Have the person see a dentist immediately. Toothache may be a signal that infection is present. Broken, chipped, or loosened teeth. Gently rinse the mouth with warm water. Place a cold, wet cloth or pad in the area of the injury to minimize swelling. The victim should see a dentist immediately. Take the broken or chipped piece of tooth along. A knocked out tooth. Pick up the tooth carefully by the crown, not the root. Rinse the tooth gently under cold running water or with milk if it's available. Do not scrub, scrape, or dry the tooth. Do not allow the tooth to dry. Flush the wound with clean water or saline solution. Apply pressure with a clean cloth or gauze to stop any bleeding. Place the tooth in a container of milk or cool water. Take the victim and the tooth and go directly to the dentist's office or emergency room, ideally within 30 minutes. Possible fractured jaw. Keep the jaw from moving by using a handkerchief, necktie, towel, or similar item and monitor the airway. If swelling is present, apply cold, wet cloths or pads. Call a dentist or take the victim immediately to the emergency room. Proper dental care and maintenance will prevent many dental injuries. To reduce the chance of tooth injury, follow these tips. Always use your safety belt when riding in an automobile. Wear the proper safety gear, including a mouth guard when you're playing contact sports. Never bite down on hard items such as popcorn kernels, ice, or nutshells. And do not use your teeth to open packages or bottles. Do not use heat or place aspirin on an aching tooth or gum tissues. Bites and stings. The bites of mosquitoes, chiggers, and no-see-ums are irritating, but not usually dangerous. More troublesome are ticks, some spiders, and some ants. To avoid getting bitten by ticks, wear long pants and a long-sleeve shirt whenever you are in tick-infested woodlands and fields. Button your collar and tuck your pants cuffs into your boots or socks. Inspect yourself daily, especially the hairy parts of your body, and immediately remove any ticks you find. Ticks bury their head beneath the skin of their victims. To remove a tick with gloved hands, grasp it with tweezers close to the skin and gently pull until it comes loose. Don't squeeze, twist, or jerk the tick, as in doing so could leave its mouth parts still buried in the skin. Wash the wound with soap and water and apply an antiseptic. Thoroughly wash your hands after handling a tick. Because some ticks carry diseases, you should seek medical care if you get sick or develop a rash after being bitten by a tick. Spiders. The female black widow spider, which is responsible for bites, is glossy black with a red-orange hourglass marking on the underside of its abdomen. These spiders like to dwell under stones and logs, in long grass, brush piles, barns, garages, latrines, and other shadowy spots. Its bite can cause redness and sharp pain, sweating, nausea and vomiting, stomach pain and cramps, and severe muscle pain and spasms. Breathing might become difficult. Brown recluse spider is a medium-sized yellow tan to dark brown spider with a violin-shaped mark on its back. These spiders often hide in little-used storage areas such as cellars and closets, and outdoors in protected areas under rocks and loose tree bark. A victim might not notice the bite at first, but within 2 to 8 hours there will be mild to severe pain with redness at the bite site. The area becomes swollen and tender, and a small blister usually forms, followed by an open sore. The victim might suffer fever, chills, nausea, vomiting, joint pain, and a faint rash. Wash the bite site with soap and water and apply a cold pack to the area. And you need to seek medical attention immediately. The sting of a fire ant can be extremely painful. If disturbed, fire ants will swarm and attack cooperatively and aggressively, often grabbing a hold of the victim's skin and stinging repeatedly. Be careful not to break the tiny blisters that form from the stings. Wash the injured area well using antiseptic or soap and water. Cover with a sterile bandage, and for relief, try a paste made of baking soda and water and take a mild non-aspirin reliever. The blistered area should heal within a week. Fire ants live in loose mounds of dirt, and if you see such a structure, do not disturb it. Some people may be highly allergic to fire ants, which can cause life-threatening reaction called anaphylactic shock or anaphylaxis. For more information, refer to life-threatening emergencies. If you are stung by a bee, but are not allergic to bee stings, you can simply remove the stinger, brushing it out with a flat-surfaced object such as a thin stick. Don't try to squeeze the stinger out. Doing so will force more venom into the skin from the sac attached to the stinger. For bee, wasp, or hornet stings, use an ice pack to help reduce pain and swelling. Common scorpion stings can often cause severe, sharp pain with swelling and discoloration, but generally cause no lasting ill effects. An ice pack or cold compress should help relieve any itching and pain. An over-the-counter antihistamine may help relieve symptoms. However, if the victim has a history of allergic reaction to insect stings or shows signs of illness, seek medical help at once. Animal bites. The bite of a dog, cat, or any other warm-blooded animal is a serious puncture wound. The animal might suffer from rabies, a deadly illness that can be transmitted through the saliva of some mammals, in particular dogs, skunks, raccoons, foxes, and bats. The only way to learn if an animal is infected is to catch it and have it tested by medical experts. An unprovoked attack could be a sign that an animal is rabid. Report all animal bites to your local public health authorities or the police. Do not kill the animal unless necessary, and do not put yourself at any risk by trying to catch the animal. Call the police, rangers, or animal control officers who are trained to do the job safely. Suspicious animals may be confined and observed or destroyed so that their brains may be tested for rabies. To treat an animal bite, scrub the area with soap and water and, if possible, flush the wound with clean water for a full 5 minutes to remove saliva. Control the bleeding and cover the wound with a sterile bandage. The victim must see a doctor who can determine whether to give rabies shots. If the bite is that of a pet dog or cat, get the name, address, and phone number of the owner if possible. If bitten by a wild animal, do not try to capture it. Instead, have someone make a note of the type of animal, its description, and the direction in which it was headed, and then contact local public health authorities to report the bite. Snake bites. The bite of a non-venomous snake causes only minor puncture wounds and can be treated as such. Since snakes are not warm-blooded, they cannot carry rabies. Scrub the bite with soap and water and treat with an antiseptic, and cover with a sterile bandage. However, a venomous snake requires special care. The venomous snakes of North America are pit vipers and coral snakes. Pit vipers, including rattlesnakes, copperheads, and cottonmouths, have triangular-shaped heads with pits on either side in front of their eyes. Signals of a pit viper bite include puncture marks, pain, perhaps extreme pain, and swelling, and possibly some severe swelling, skin discoloration, nausea and vomiting, shallow breathing, blurred vision, and shock. Coral snakes have black noses and are marked with red and yellow bands side by side, separated by bands of black. They inject a powerful venom that affects the victim's nervous system. The signals of a coral snake bite include slow physical and mental reactions, sleepiness, nausea, shortness of breath, convulsions, shock, and coma. The bite of a venomous snake can cause sharp, burning pain. The area around the bite might swell and become discolored. However, a venomous snake does not inject venom every time it bites. Here are the steps for treating the bite of venomous snakes. Step 1. Get the victim under medical care as soon as possible so that physicians can neutralize the venom. Step 2. Remove rings and other jewelry that might cause problems if the area around the bite swells. Step 3. If the victim must wait for medical attention to arrive, wash the wound. If it is the bite of a venomous snake, wrap the area snugly but comfortably with an elastic roller bandage, or an ACE bandage if you will. Frequently check the area above and below the injury for feeling, warmth, and color. Check for snugness. A finger should easily but not loosely pass under the bandage. Step 4. Have the victim lie down and position the bitten part lower than the level of the heart. Encourage him to stay calm. He might be very frightened, so keep assuring him that he is being cared for and treat for shock. As a precaution, use a hiking stick to poke among stones and brush ahead of you when you walk through areas where snakes are common. Watch where you put your hands as you collect firewood or climb over rocks and logs. Do not give a snakebite victim alcohol, sedatives, or aspirin. Do not apply ice to the snakebite. Ice will not help the injury but could damage the tissue and the skin. Do not make any cuts or apply suction to the bite. Apply ice or apply a tourniquet or use electric shock such as from a car battery. These methods could cause more harm to the victim or are not proven to be effective. Life-threatening emergencies. The right first aid given quickly can save a life. A person who has stopped breathing must receive rescue breathing within 3 to 5 minutes or brain damage will occur. People who may need life-saving first aid include victims of heart attacks, deep cuts with severe bleeding, submersion emergency or near drowning, and lightning strikes. After calling for help, assess the situation to decide what you should do and in which order. Is the person conscious? Check for signs of life. Tap the person on the shoulder to see if he or she responds. Ask questions such as, "Are you okay?" If there is no response to sound or touch, the person is unconscious. If you're by yourself, call for medical help. In most areas, this means dialing 911 to activate your community emergency response system. If someone is with you, have them call for medical help. If the victim is a child or an infant and you are alone, give 2 minutes of care before you leave to find medical help. The order of treatment in a life-threatening emergency is call for medical help, automated external defibrillator, compressions, airway, and breathing. An automated external defibrillator. After calling or sending for medical help, it's critical that the next step is to get an AED if one is nearby and easily accessible. If you are by yourself, go get it, attach and use the AED, then provide compressions. If someone is with you, one of you should call for medical help and get the AED. The other person should start with compressions. And here is why this is so important. The heart is made up of many muscle fibers, that usually contract and relax in unison to pump blood. During a heart attack, those muscle fibers do not work together. A heart attack can lead to what is known as cardiac arrest. Another cause of cardiac arrest is an abnormal electrical heart rhythm, more commonly known as sudden cardiac arrest or ventricular fibrillation. A machine called a defibrillator can send an electrical shock through the heart to momentarily stop all electrical activity. This pause gives the heart enough time to try to restore an effective heartbeat or a rhythm. A person whose heart has stopped functioning can be treated with this special device if one is available. Ideally, this should happen within several minutes of the victim's collapse. Most ambulances, hospitals, and emergency care facilities are equipped with defibrillators for use by trained medical personnel. Because a defibrillator must be used quickly, within several minutes, to save a person's life, a new type of defibrillator called an automatic external defibrillator, or AED, has been developed. Many first responders, such as police officers and firefighters, carry and are trained in the use of AEDs. An AED is computerized. It can check a person's heart rhythm and recognize a rhythm that requires a shock. It can also advise the rescuer when a shock is needed. AEDs are voice prompts, lights, and text messages to tell the rescuer the steps to take. AEDs are very accurate and easy to use. With only a few hours of training, a layperson can learn how to operate an AED. However, you must be trained to operate one safely and effectively. Now, many places such as airports and shopping malls now have installed AEDs in clearly marked designated areas, much in the same way that fire extinguishers are made readily available for access in an emergency. Compressions. Signs of circulation mean that the heart is still beating and circulating blood through the body. Normal breathing and movements are signals of life and that there is a heartbeat. If there are no signs of life and no breathing, begin CPR chest compressions immediately. Accidents or medical conditions that cause a person to stop breathing can also stop the heart. If the heart is not pumping and circulating blood through the body, the victim will not be breathing, moving, or making normal sounds. You should perform CPR or cardiopulmonary resuscitation immediately. Continue cycles of CPR, 30 chest compressions and 2 breaths. Do not stop CPR except in one of these situations. You find an obvious sign of life, such as breathing, an AED is ready to use, another trained responder or EMT comes to take over, you become too exhausted to continue, or the scene becomes unsafe. Learning CPR requires careful instruction from a certified teacher. Perhaps you can practice CPR at Scout meetings. The American Red Cross, American Heart Association, and Emergency Care and Safety Institute offer classes too. And your Scout leaders can help you find training to learn this life-saving skill. While the techniques for CPR are different for adults, children, and infants, the cycle of 30 chest compressions followed by 2 rescue breaths applies to everyone. To receive full and proper CPR training, contact your American Red Cross chapter, the American Heart Association, or the Emergency Care and Safety Institute. And they have some resources in the back of the pamphlet for more information. Airway. The airway is the passage that allows air entering the mouth or nose to reach the lungs. Always protect the airway of any accident victim. If the person begins to vomit, turn the victim onto his or her side so that the vomit comes out of the mouth and is not aspirated or inhaled into the lungs. If the victim is unconscious, carefully place the person on his or her back, protecting the head and neck if you must roll the person over. Then there is no risk for head or spinal injury. Open the airway by pressing or tilting on the forehead with one hand and lifting the chin with the other to tilt back the head. This action will keep the tongue from blocking the person's airway. Breathing. After opening the victim's airway, check to see if the person can breathe normally. Place your cheek in front of the victim's mouth about 1 to 2 inches away. Look, listen, and feel for signs of movement and breathing, signals of circulation or signs of life, for no more than 10 seconds. If the person is breathing effectively, you will feel and hear the airflow on your cheek and see and feel the chest rising and falling at regular intervals. If there is no breathing or movement from an adult, immediately begin CPR. For an infant or a child, give 2 rescue breaths before performing CPR. Step 1. Place a CPR breathing barrier over the victim's mouth. This may protect the both of you from orally transmitted diseases. Give 2 rescue breaths. While maintaining the head tilt, pinch the nostrils, seal your mouth over the victim's mouth, and blow into it to fill a person's lungs. For an infant, seal your mouth over both the mouth and nose, and then breathe gently. Each breath should last about 1 second. Watch to see the chest clearly rises. Remove your mouth and then give another rescue breath. If the victim revives, put him or her in a recovery position and treat for shock. Monitor the person to make sure breathing does not stop again. CPR breathing barriers. While the risk of getting disease from giving rescue breaths is extremely small, you should use a breathing barrier between your mouth and the victim's if one is available. This will protect you from contact with the victim's bodily fluids from breathing the air exhaled from the injured or ill person. Place the breathing barrier over the victim's mouth as directed on the device. If you have not been trained in CPR or are unable to perform rescue breaths, then just perform compressions until an AED arrives or medical personnel can take over care of the victim. Heart attack. A heart attack is a life-threatening condition that causes death or damage to the heart muscle. When an artery that supplies blood to the heart is blocked, a heart attack can occur. Heart attack requires quick action to possibly save a life. Learn to recognize the warning signals of a heart attack, then be prepared to take prompt action by calling 911 or the local emergency response number. Immediately administer CPR if necessary. Common warning signals of a heart attack. Here are some of the common warning signals of a heart attack. Persistent, uncomfortable pressure, squeezing, fullness, or pain in the center of the chest behind the breastbone. It may last several minutes or longer, and it may come and go, and it need not be severe. Pain spreading to the shoulders, arms, neck, or jaw. Unusual sweating, for instance, perspiring even though a room is cool. Nausea, stomach distress with an urge to vomit. Shortness of breath, a feeling of weakness. Should anyone complain of these symptoms, call 911 to get medical attention for the victim right away. Be aware that a common reaction of men and women who are experiencing signals of a heart attack is to deny that anything is wrong. Be ready to begin CPR if the heartbeat and the breathing stop. If you suspect someone is having a heart attack and this person is conscious, try to find out the following. Is the person taking any type of blood-thinning medication? Is the person allergic to aspirin? Does this person have stomach problems? Has the person ever been advised by a physician not to take aspirin? If the answer is no to all of the questions above, when you call 911, emergency responders may advise you to offer the person 2 uncoated baby aspirin tablets, 81 milligrams apiece. Aspirin must be used, not painkillers such as ibuprofen, Advil, Motrin, or acetaminophen or Tylenol. Stroke. A stroke, called a brain attack, occurs when an artery to the brain either bursts or is blocked by a clot. When blood supply to the brain is interrupted, brain cells begin to die. Common warning signals of a stroke. The disease injures the brain and the signals happen fast. The victim might not be aware a stroke is occurring. Others nearby might not know it either. This is why it is so important to know the common warning signals of a stroke. Sudden weakness or numbness of the face, arm, or leg, especially on one side of the body. Sudden confusion or trouble speaking or understanding speech. Sudden trouble seeing. Sudden dizziness with loss of balance or coordination and trouble walking. Sudden and severe headache with no known cause. Think fast. Use this quick method to determine whether someone might have suffered a stroke. F. Face. Ask the person to smile. Watch for weakness on one side of the face, which will look like a drooping mouth and cheek. A. Arm. Ask the person to raise both arms. Watch for weakness or numbness in the limbs. Does one arm drift downward? Speech. Ask the person to say a simple sentence such as, "May I have a cookie?" Listen for slurred speech. T. Time. Time to call 911 right away if the person cannot perform any one of the simple tasks above or shows any of the signals of a stroke. And be sure to note the time that the signals began. When someone is choking, a person who is choking and can cough, speak, or breathe is still getting some air to the lungs. Encourage him or her to cough up the object and be ready to administer first aid if it is needed. However, if the person is coughing weakly or making high-pitched noises, or if the person can't cough, speak, or breathe, you will need to take quick action. Ask the person if they are choking and get consent to help them. Have someone call for help, then do the following. Step 1. If the child or adult is conscious, give 5 back blows. From behind, place one arm across the person's chest and lean forward. Firmly strike the person's back with the heel of your hand. Follow the 5 back blows with abdominal thrusts as described in steps 2 and 3. Stand behind the victim, put your arms around the waist, make a fist, place the thumb side against the body just above the navel. Cover your fist with your other hand. Step 3, thrust your clasped hands inward and upward with enough force to pop loose the obstruction. Do this 5 times if needed. Step 4, repeat steps 1 through 3 until the obstruction clears, medical help arrives, or the person becomes unconscious. Severe bleeding. A careless moment with a knife, an axe, or a power tool, or any number of other accidents can sever a large blood vessel in the arm or leg, causing severe bleeding. Quick first aid action can stop bleeding and perhaps save a person from bleeding to death. First aid for severe bleeding. Put on non-latex disposable gloves and protective goggles. Do not remove any large penetrating objects. With a clean cloth or sterile dressing as a pad, use the palm of your hand to apply firm pressure directly over the wound. If you have an elastic bandage handy, or an ACE wrap if you will, Use it to secure the pad tightly over the source of the bleeding. If a pressure pad has become soaked with blood, place a fresh pad over the first one. Don't remove the first one, and continue applying pressure. Step 2. After the bleeding stops, hold the pad in place with a sterile bandage, an athletic wrap, strips from torn, clean clothing, or something else similar close at hand. Bind the pad firmly, but not so tightly that circulation is cut off. Step 3. If the bandage is on an arm or a leg, periodically check for circulation, feeling, warmth, and color. No circulation is an indication that the bandage should be loosened. Tourniquets. For the most extreme cases of severe bleeding, first aiders have sometimes used a tourniquet, a device designed specifically to be tightened above a limb or an extremity that has been partially or completely severed, as a last resort for stopping bleeding. This method is used only when all other efforts have failed and advanced professional medical care is delayed by at least 30 minutes or is not available. A tourniquet will completely stop the flow of blood to the limb. It can also cause gangrene, tissue death, and may require surgical amputation of the limb. In the past, field tourniquets were made from a strip of cloth at least 2 inches wide, never a cord, wire, rope, or any other thin material. The strip was tied with an overhand knot above the wound, and a stick, tent peg, or similar rod-shaped object was placed on the knot and tied down with a square knot. The stick was then twisted just until the bleeding stopped, and then secured so the tourniquet would not come loose. Today, if a tourniquet must be used, it is generally a commercially made device designed for this specific purpose. Once a tourniquet has been applied, a written note of the location of the tourniquet and the time it was applied is made and attached to the victim's clothing in an obvious location. The victim should be treated for shock and given first aid for other injuries. The tourniquet must not be covered. If medical help can be reached quickly, monitor the victim and do not remove the tourniquet. If it is likely that it will be hours before advanced medical help is available and the scene is safe, the patient is stable with direct pressure, then the tourniquet should be loosened to determine if bleeding has stopped and also to allow some blood flow to the limb. If bleeding continues, the tourniquet should be tightened and then released approximately every 2 hours to assess if it is still needed. If bleeding has greatly slowed or stopped, continue use of the pressure dressing but leave the tourniquet in place. Improper or prolonged placement of a tourniquet can lead to complications such as nerve paralysis and damage to or loss of a limb. For any case of severe bleeding, summon emergency medical help immediately. You should always use non-latex disposable gloves and protective goggles when rendering aid to a person who is bleeding. Because of the many risks associated with the application of a tourniquet, this method is best left to trained medical professionals or skilled responders, especially trained in the application of tourniquets. Anaphylactic shock. For most people, bee or wasp stings will cause pain, redness, and a little swelling around the affected area, and perhaps a few days of itching. For the small number of people who are allergic to bee or wasp venom or fire ant bites, these stings and bites can cause a life-threatening reaction called anaphylactic shock or anaphylaxis. Symptoms can include a swelling of the throat, tissues, or tongue that restricts air passages and makes breathing difficult or even impossible. Without immediate treatment, a person who goes into anaphylactic shock can die. People who are allergic to peanuts, shellfish, and certain other foods can have similar anaphylactic reactions if they ingest or even inhale particles of these foods. For instance, people who are allergic to peanuts cannot consume foods cooked in peanut oil. Any scout who has an allergy that could cause anaphylactic shock should share that information with scout leaders and always let the group leaders know where he carries anaphylaxis medications so they can be made available at a moment's choice. First aid for anaphylactic shock. Step 1. Call 911 or your local emergency response number. Step 2. Check the victim for a medical ID bracelet, necklace, or information card. Ask if the person is carrying a prescribed emergency medical kit. You may be able to assist the person under certain circumstances and, if you are trained and allowed to assist by state or local regulations. If so, follow the kit instructions exactly and assist the person by locating the medication kit and handing it to him or her. It is best that the individual administers the medication. If the person is unconscious, follow the ABCD life-saving sequence and/or follow instructions provided by emergency medical professionals. Step 3. See that the victim receives follow-up medical treatment. If you are not qualified to administer epinephrine, you should help to make sure the person stays in a comfortable position for breathing while awaiting medical help. This will usually be a sitting position. Life-threatening food allergies are rare. However, an increasing number of people suffer from food allergy reactions that, although not life-threatening, can cause great discomfort. If you have a food allergy, always be sure to let the scout leaders know about it. They can then work with members of the patrol and troop to ensure that the foods that trigger allergic reaction are avoided during the planning and carrying out of scout events. Making a situation safe for everyone is also a way to increase the sense of cooperation and support within a scout unit. People who know they are susceptible to anaphylaxis should carry emergency kits that contain an injection of epinephrine, a rapidly acting medicine that temporarily reverses the effects of anaphylactic shock.